The World Health Organization is declaring a global emergency over the spread of Mpox for the second time in 2 years. African health officials say the viral illness, formerly called monkeypox, has been quickly spreading across the continent. And today, officials report the first case out of Africa in Sweden. Dr. Anne Ramoyne is a UCLA epidemiologist. She just returned from working in Central Africa, and now she's here in our studio. It's good to have you.
Thanks for having me.
So we get this alert from the World Health Organization. It's not the first time we've been through this. How concerning is this?
Well, here we are again. We had Mpox spreading globally in 2022. We saw it emerge out of Africa and spread around the world. Now this is happening again. Well, what we're seeing is a big increase in cases in Africa. And as I've said to you many times before, an infection anywhere is potentially an infection everywhere. So, of course, it's really important to get in front of it as soon as possible. And that's why it was so important that Africa CDC and the World Health Organization called public health emergencies so that we can focus resources to deal with the problem at its source.
There's a vaccine. When we talked about what happened in 2022 here, a lot of people got the vaccine. Does this vaccine protect against this particular strain?
This vaccine should work against whether it's clade 1, which is now what we're seeing here, or clade 2, which is what was circulating previously. It's effective against both, and that's really good news. There are definitely all of these tools that we have to be able to employ. But the thing is, we had them to be able to stop the epidemic here, or the outbreaks here in the United States and in high-resource settings. In places like Africa, that vaccine has not yet been made available. So this announcement of a public health emergency is going to focus resources and get countries to come together to be able to provide Africa with the resources to control that outbreak at its source.
Do you expect this to wind up here in Southern California anytime soon? And second question, follow-up, would be, this last impacted mostly the LGBTQ community here in the States. Is that still the same?
The high-risk groups are going to be the LGBTQ populations. It's also going to be people who do sex work. It's people who have extensive sexual networks, which are usually the groups at risk when you're talking about a disease that can be transmitted sexually. And it'll be the same thing in this scenario here. But the good news is that vaccines have been deployed widely in those communities. I think that the bigger message is if you haven't been vaccinated yet, now's a great time to get vaccinated or to finish that vaccine series. It's a 2-dose vaccine. And just to have situational awareness. Right now, we've only seen 1 case reported of this particular clade or this variant in Europe, but certainly it's because people haven't been looking, and we'll start to see more because, as I said, infection anywhere is potentially an infection everywhere. And
so that we're very clear, this is not like COVID. This is not a respiratory disease. This is spread through bodily fluids.
Right.
Okay.
This is close contact.
Got it.
Either close contact, so what normally happens so the vast majority of cases, have to remember, in Africa, in DRC, 90% of those cases are still in children under the age of 15. It's because they're having contact with wild animals. Then they bring it home, they may infect a few other people in their household. So it can be from contact with clothing or bedding or close contact caring for somebody who has Mpox.
Well, speaking of Africa, you were just there, as mentioned, in the Democratic Republic of the Congo. We have some images of Dr. Ramoyne there. What was the big takeaway from your travels?
Well, I've been running a research program there for the last 20 years and working with my collaborators, my longtime collaborators on the ground in DRC. You know, the issue is we need to have vaccines in place to be able to control the outbreak. We need to do better with diagnostics, so being able to have tests available to test people, to have better surveillance, and really just strengthen the local health system to be able to deal with this before it becomes an issue. And that's always the case, right? It's better to deal with something before it becomes a problem, or as my late father-in-law used to say, it's much easier to stay out of trouble than it is to get out of trouble. And that's always the case with infectious disease, with emerging diseases. It's much better to be ahead of it than chasing behind it.
In terms of a timeline, your father-in-law, a smart man, by the way, how soon, this is something I asked you when I asked you 2 questions at once, that's bad me, bad interviewer, how soon could we expect this to end up here?
You know, it's very possible that it may be already circulating, but it's hard to know.
Yeah.
You know, it's something that is sexually transmitted, you know, reasonably easily. We've seen this happen with Mpox in the United States and globally a few years back. But again, the good news that vaccines protect very well against this variant, as well as the variant that spread previously. We were able to get it under control before. There's probably a reasonable amount of population immunity in populations that'll be exposed. So good thing to be situationally aware and to be proactive.
Easier to stay out of trouble than to get into trouble. That's a takeaway.
To get out of trouble.
Yeah, then to get out of trouble. There we go. Okay, Dr. Anne Ramoyne, UCLA epidemiologist, thank you so much.
My pleasure. Nice to be here.